which is how to close the gap for cancer care in ethnic minorities. This is one of the crucial issues in cancer care these days. Recent publications have emphasized the fact that despite new treatment, despite novel therapies, despite improvements in cancer care, still ethnic minorities don't get the outcomes that other ethnic groups get. And this is something, of course, that we need to improve. Next slide, please. This is important because still some new reports have shown that there's still some disparities in terms of treatment and management strategies and outcomes if we compare ethnic minorities versus non-ethnic minorities. And these differences are completely independent of characteristics of cancer or other variables or factors. And the gaps continue to increase over time. So this is something that definitely we need to tackle and definitely we need to concentrate efforts on. Next slide, please. What are some of the strategies that we can use to decrease this outcome or decrease these gaps? So we need to understand the reasons for difference in outcomes. In some of the solid malignancies, like a breast cancer, lung cancer, and such, there are many studies looking into some of these factors. But in others, such as blood cancers and bone marrow transplant, for instance, there's not much information, and that is something that we need to, of course, determine and discover. Social determinants of health, meaning all the social characteristics that perhaps impede access to care, also that have been studied for ethnic minorities. And this is something also that we need to emphasize and review. We need to, of course, establish new paradigms in terms of management strategies. We need to just kind of make sure that we encourage these ethnic minorities to come to cancer centers, but we need to understand, again, patterns of referral. How did they get to cancer centers? Why they don't get to cancer centers? What sort of cultural aspects we need to tackle in order to make sure that these patients come to cancer centers and get the treatment that they need. We also need to develop databases to identify populations of risk. We know that certain within the ethnic minorities, not everyone is a risk. So we need to determine which ones or which groups or subgroups are specifically a very high risk for not only cancer, but also bad cancer outcomes. And of course, we need to improve the quality review outcomes and management strategies. And also we need to improve certain things such as navigation systems, case management, social working systems, because for sure we're missing some of these patients, and some of these patients don't come to the cancer centers. Next slide, please. So in conclusion, we need to close these gaps, and this is something that is work in progress. It is imperative that we achieve certain stability in terms of outcomes for ethnic minorities versus non-ethnic minorities. We need more strategies to enhance the presence of cancer centers in the community. Community outreach strategies are very important because definitely we need to improve access to cancer centers. A multidisciplinary approach is very much needed. We will not include other specialties, but also social scientists, navigators, case management, and so forth. And also a certain aspect that perhaps is very important, mental health. Mental health is also very important to close the gap, not only here, but also in the other, for instance, in HIV care, geriatric oncology care, and so forth, is something very important. Of course, we need to improve navigation systems, social care, and other aspects that are really important, for instance, transportation, food access, and so forth. Things that perhaps we overlooked in the past, but at this particular point are really important to focus to improve the care or outcome of these populations. And I think with that, we finish the topics. Thank you very much for your attention.